My name is Mohan, Suntha. I'm professor of radiation oncology here at the Marlene and Stewart Greenenbaum Cancer Center. My clinical and research focus is on patients who have been diagnosed with cancers of the head and neck and/or esophagus. The treatment of these diseases has evolved over the last decade to include a true multidisciplinary approach where surgery, chemotherapy, and radiation are integrated to define an optimal treatment plan for any individual patient. Across the board, we've seen trends where patients should be considered for primary radiation management depending on the stage of their disease. And so it is imperative that patients get a true multidisciplinary assessment before treatment is initiated. Here at the Cancer Center, we have a particular focus on ensuring that all patients get a multidisciplinary evaluation prior to the initiation of therapy. From a radiation oncology perspective, that includes the assessment of the appropriate use of technology. Here in our department, we are fortunate that we have many of the latest and greatest technologies available to patients throughout the country, all in one location. And it is our particular challenge to design a treatment plan that utilizes that level of technology that is appropriate for any individual patient. The patients who have these diagnoses clearly benefit from a multidisciplinary approach to their disease. At our cancer center, that is defined by having patients evaluated by all specialists before initiation of any therapy so that the optimal treatment plan can be designed. In patients diagnosed with head, neck, or esophageal cancer, that means they are meeting the medical oncologist, the surgeons, and myself before a treatment plan is designed. Part of the advantage of being at a university setting is that we do have access to and often design clinical trials that offer patients opportunity to receive the latest in cancer therapies as part of their routine care. There is probably no more anxiety-provoking experience for a patient than to be told that they have a cancer diagnosis, and I think here we recognize that initial anxiety. I'm fond of telling my patients that in life we don't get to choose the battles that we have to fight, we only get to choose how we fight them. And I think that our team has a particular focus on supporting not just a patient, but a patient and their family through treatment and well beyond treatment to help them deal with the side effects of therapy, the emotional impacts that come with the diagnosis, and then the recovery that follows.